Prostate cancer is now the most common malignancy in males. The prostate gland is a gland that every male is born with. It's a part of the male reproductive system and helps in processing the sperm production, which is very essential for the process of fertility. So the prostate gland needs to function at the younger age, but as the age wears on, the functioning of the prostate gland is no longer as important as it is in the youth. However, with age, just like other changes that occur in the human body, like graying of hair, other things which we consider as a part and process of aging, the prostate gland can enlarge. Once the prostate gland enlarges, it causes an obstruction to the outflow of the urine from the urinary bladder. So prostate gland పెరిగినప్పుడు యూరిన్ ఫ్లో సరిగా ఉండకపోవటం కానీ, స్ట్రెయిన్ చేసే కానీ బ్లాడర్ ఎంటీ అవ్వలేదు, యూరిన్ పాస్ చేసిన తర్వాత మళ్ళీ ఇంకోసారి యూరిన్ పాస్ చేయాల్సి రావడం, ఇలాంటి సిమ్టమ్స్ అవి వస్తాయి. సో ఇన్ ద ఓల్డర్ డేస్ there used to be no medical management for prostate, and invariably anybody who had these kind of symptoms either had to live with them or had to undergo a major open surgical removal of the prostate gland. Nowadays, with advanced medical technologies, most of these symptoms are managed by simple drugs which are not very expensive to use, drugs which do not cause significant side effects, and drugs which actually provide a lot of symptomatic relief. So if these drugs don't work, then there's always minimally invasive laser surgeries available nowadays to address these kind of symptoms. So if anybody over the age of 50 is going through these kind of symptoms with difficulty in passing urine, it is always better to consider a urologist at the early stage, because diagnosing these kind of obstruction and differentiating them from malignancies is important. Malignancy of the prostate gland also unfortunately can present with the same kind of symptoms. So I see a lot of people who actually have malignancy, but considering that all that they have is a weakened urinary stain, most of them say this is what age does, this is because of my being this old kind of a things. So an early diagnosis of a cancer is missed, and a potentially treatable curable disease is converted into a widespread metastatic disease which can no longer be cured. So it's important that one consulting a urologist early in the game. So differentiating malignancy from a age-related enlargement of the prostate can be done with a few simple tests in the outpatient, as well as a simple blood test which we call as serum PSA. PSA is an enzyme that is elevated in malignancies. So whoever has any kind of these symptoms undergoing this kind of blood test can be differentiated from cancerous tests. PSA is also a test that we employ in screening of the population. So if somebody has a family history of prostate cancer, when parents or grandparents or elder brothers have prostate cancer, we recommend getting a PSA screening done from the age of 45 itself, because an early detection can save your life.